Greetings to everyone. The title of our research work is A Novel Application of a Bioactiva Smart Material as a Pit and Fissure Sealant. The team members are Debolina Bishayi, Aishwarya Srinivasan, Dr. Karuna Y.M. and Dr. Srikant N. Done in Department of Periodontics and Preventive Dentistry and Department of Oral Pathology and Microbiology, Manipal College of Dental Sciences, Mangalore, Manipal University.
Dental caries is one of the most common intraoral diseases. Pit and fissure caries accounts for 44% of caries in the primary teeth and 80 to 90% in the permanent teeth. Available evidence suggests that sealants are effective and safe to prevent or arrest the progression of non-cavitated carious lesions. Resin-based sealants and glass ionomer sealants are generally used for the purpose of pit and fissure sealing, but their disadvantages include polymerization shrinkage and moisture sensitivity. And also fracture of the material can occur due to its reduced ability to withstand occlusal forces. The compromised retention is other drawback. Bioactive smart material are a relatively new concept in dentistry. They are reported to release more fluoride than glass ionomers, and their unique chemistry supports the natural remineralization process and helps form a seal between the material and the tooth. Additionally, they react to pH changes in the mouth by uptaking calcium, phosphate and fluoride ions to maintain the chemical integrity of the tooth structure. One such recent introduced new smart material is the Activa Bioactive Base Liner. According to its manufacturers, it combines between the strength and aesthetics of composite resins and the benefits of glass ionomers such as moisture tolerance, chemical bond to the tooth and release and recharge of calcium phosphate ions in addition to fluoride. All of these properties of Activa Bioactive instigate us to evaluate its ability to be used as a pit and fissure sealant. However, apart from the above said properties, penetration of the material used into the complete depths of pit and fissures, its lateral wall adaptation and subsequent retention are the key factors in the longevity of pit and fissure sealants. Apart from the penetration depth of the sealant, extension of the sealant material over the enamel of the cuspal inclines is another factor considered in successful bonding of pit and fissure sealant to the tooth. The objectives of our study is comparison of sealing ability, penetration and adaptation of a bioactive smart material used as a pit and fissure sealant to those of glass ionomer sealant. Null hypothesis is that there won't be any difference in properties of the bioactive smart material when compared to those of GIC fissure sealant.
Materials and methods. The study was conducted on permanent teeth, premolars and molars, extracted for orthodontic and therapeutic purposes. The stereomicroscopic analysis was done in the Department of Oral Pathology in Manipal College of Dental Sciences, Mangalore. The methodology: 20 non-carious erupted intact permanent teeth extracted for orthodontic and therapeutic purposes with deep pits and fissures were selected. After thorough rinsing and air drying, the teeth were randomly divided into two groups of 10 teeth each. The group 1, that is the bioactive smart material sealant. The tooth was slightly dried, removing excess moisture. The mixture was placed on the Activa syringe. The material was dispensed onto a mixing pad with the help of a plastic filling instrument. A disposable fine brush was used to spread it on pits and fissures, and sealant was then allowed to flow for 10 seconds. It was then light cured using 20-second low intensity light setting. Group 2, Type 4 GIC sealant. The occlusal surface was gently cleaned with a GC conditioner for 20 seconds and rinsed for 20 seconds. The surfaces were then dried by blotting with cotton pellet. The GC Fuji4 glass ionomer cement was mixed as per the manufacturer's instructions and applied to the occlusal surface using a plastic filling instrument. A disposable fine brush was used to spread it on pits and fissures, and sealant was then allowed to flow for 10 seconds. After that, sealant was light cured for 20 seconds, followed by application of petroleum jelly on the occlusal surfaces. Following sealant application, the teeth were subjected to thermal cycling for 1500 cycles, alternating between 5 degrees Celsius and 55 degrees Celsius. Evaluation of sealing ability, sealant penetration and adaptation with 10 teeth per group. The apex of each tooth was sealed using composite resin, following which 2 layers of nail polish was applied to within 1 mm of the sealant margin. The teeth were then immersed for 24 hours in 1% methylene blue solution buffered at pH 7. They were then rinsed under running water for 10 minutes and cleaned. The specimens were completely embedded in clear autopolymerizing acrylic resin and were sectioned longitudinally buccolingually from the central fossa, yielding 2 sections of 500 micrometers per tooth using a water-cooled diamond disc mounted on a saw at low speed. Sections were then viewed using a binocular light microscope at a minimum magnification of 4x for fissure morphology, sealant penetration, unfilled space, lateral wall adaptation, and for any voids. The parameters that were studied include fissure morphology, sealant penetration depth, length of unfilled space, total length of fissure, and penetrability percentage. All the linear measurements were made with the help of software ImageJ and calculated in microns. 3 measurements of each section was taken and the mean value of these readings per section was adopted as the representative values. The values were then tabulated and subjected to statistical analysis. The result: comparison of the sealant penetration depth between the two groups shows that sealant penetration depth is higher in group 1 group with a t-value of 0.099 and is statistically non-significant with a p-value of 0.922. Comparison of the length of unfilled space between the two groups shows that length of unfilled space is higher in group 1 group with a t-value of 1.593 and is statistically non-significant with a p-value of 0.145. Comparison of the total length of fissure between the two groups shows that total length of fissure is higher in group 2 group with a t-value of 0.536 and is statistically non-significant with a p-value of 0.6. Comparison of the penetrability between the two groups shows that penetrability is higher in group 1 group with a t-value of 1.712 and is statistically non-significant with a p-value of 0.104. Comparison of the microleakage scores between the two groups shows that microleakage scores is higher in group 1 group with a t-value of 0 and is statistically non-significant with a p-value of 1.
The conclusion for this research study is that within the limitations of the study, a novel application of Activa bioactive smart material as a sealant material was successful in terms of penetration properties and microleakage. Thank you.